Increasingly, we are recognizing that colon cancer is not just one disease, it's a compendium of smaller subsets. And our study focuses on one of these distinct subsets, and all these subsets have some characteristics. So this subset is characterized by amplification of the gene HER2. Now, this amplification is seen very commonly in breast cancer and gastric cancer, and actually there are drugs that can target this gene. So our interest in this subset of colon cancer, of course, it stems from the fact that you have potentially really active drugs that can target this subset. So we looked at our group of patients in which patients had HER2 amplifications, and then there were others that didn't have HER2 amplifications, and what we tried to do is try to see the difference between these two. Now, preclinically, we know that these patients who have this gene amplification, they are resistant to anti-EGFR monoclonal antibodies, specifically cetuximab and panitumumab, which are currently the standard of care in colon cancer. When you have this gene, these patients don't respond. So when we looked at our group, we took patients who had received these anti-EGFR monoclonal antibodies with chemotherapy, and we found that the HER2 amplified patients did not respond at all. In fact, the progression-free survival in this group was less than 3 months compared to 8 to 9 months in patients who were not HER2 amplified. So we strongly believe that this is a negative predictive biomarker for anti-EGFR chemotherapy.